Okay, yes, we are streaming now. We can get back to Facebook. Okay, you all are welcome. Marenica, you are welcome. Let me welcome 2 more people. You all are welcome. If you come in, please type in your presence, answer present. Just say something so that I know you are here. Okay, Elizabeth, you are welcome.
Thank you, sir.
Thank you. Thank you. Who else is here? Chi, you are welcome. That's what I see here. Please, let's just share. We have a combination of those who have registered for this class and those who are thinking about registering. So it's an open orientation day. So I welcome you all. Okay, good. Loris, now I can see your face. Thank you. Thank you. Who is couples timeout? Let's see your face. Today is our first day. Loris, I think you are muted. You can unmute yourself.
Yeah. Yes, I am muted.
No, you're still muted.
Are you hearing me now? Hello.
Hold on, let me make sure it's not on my end. No, it's not.
My mic is unmuted on my side.
You can hear them? I think it's on my end. Let me do something. Okay, now I can hear you, Lawrence. Go ahead.
Oh, good evening, everyone. Thank you, sir, for the begin orientation of today. We are ready.
Thank you, Lawrence.
And good evening, all of us in class.
Thank you.
Good evening. God bless you.
Where is
You're
Madam
welcome.
May? Where is
Yeah,
Madam May?
well, I guess everybody knows Madam May. Yeah, I will greet her. Who else is here? Who else wants to say hello? Let's keep going. I see some people have typed in something. Okay, compliments, info. Is that info? I hope that's how it's pronounced. No volume on your side. Hopefully that's not the case with everybody. I don't think so. You all are welcome. You all are welcome. Okay, well, let's go. This is a really small class, unusually small. We usually would have a larger number than we have in this class. But this is a small class. I think we are less than 10. That's good for you guys, not good for TIFA, but whatever happens is not your fault. So we are going to enjoy the sessions. We are going to enjoy them. For those who are new to TIFA, my name is Victor. I am a licensed therapist in the state of Texas. I'm also a licensed marriage and family therapist. I am a substance abuse licensed counselor, which means I'm a drug and alcohol counselor. So all these licenses are what I have. I am a mental health therapist, so I do all those things. But my passion is marriage and family. I am here, meaning we are doing mental health and addiction because it affects families. That's how I ended up here. So whatever affects families affects me. I seek to advance my skills and my knowledge in those areas so I can be effective in what I do. That's how I became all these licenses, because I'm trying to improve my skills and knowledge as a marriage and family counselor. That's where we started. So you are in good place. You're in good place. I will shortly go into go to my PowerPoint so that we all will understand, will follow what I am saying. Before I do that, any question or comments? Let's just go ahead. I think I've heard from Lawrence, I've heard from Info. Any other person that's come that needs to introduce yourself, just say your name, where you are if you like, but just your name, and if you are a registered student or you are a prospective student, because we have those two populations. Some people are here auditing this class, meaning they are checking us out. Some people are here because you already checked us out and you've made up your mind to be a student. So let's keep going. Omoye, I see your hand raised. Go ahead.
Hi, everyone. So my name is Omoye Fishintin. I am a registered student. I did my marriage and family counseling certification with Team FAR. So it's good to be here.
Okay, thank you, Omoye. Thank you. So you are a returning student. You're already familiar with the system. Thank you. Who else wants to go? Let's keep going. Let's keep going.
Good
Hello,
evening,
everybody.
everyone.
Okay, go ahead, Mabo.
I'm Dr. Merima Boto Betiswa. A returning student. I have registered. I did the marriage and family training with TIMFA. Thank you.
Thank you, Doc. Thank you very much. Go ahead. I see couples timeouts. That's what I see. I don't see a name, but if that's you, go ahead. And then anybody else can go ahead.
Good evening, everybody.
Good evening.
My name is Elizabeth Harris. I reside in United Kingdom. I'm a returning student. I was in the 2023 marriage and family counseling class. Thank you.
Thank you. Thank you, Elizabeth. Thank you very much. Anybody else?
Hello. Hi. Good evening, everyone. My name is Dr. Annie. This is my first time. I heard about the mental health addiction counseling through a friend of mine, and I registered. And yeah, from Nigeria, actually. Yeah.
Welcome, Doctor.
Thank you.
Welcome,
Yeah.
Dr. Annie. You're the one that I went back and forth with.
Good
Good to see you. Now you know we're real. You'll see a
Yes,
lot
of
of
course.
returning students.
Yes, I
We are
have.
not
Thank
a
you.
scam. We are real. I know you
I
were
just-
checking out this kind of scam.
Yeah.
No. You see a
No,
lot
I
of people
know.
returning. We are
Yes, I
as
have.
firm as a northern star.
Yes,
We've been
I
here
can
for
see
10.
that. Thank you
Thank you.
so much. Thank you. Pleasure
Thank
to meet everyone. Thank you.
Welcome. Let's keep going. Who else? Who else wants to go?
Okay, Lawrence, let me go.
Okay, go ahead, Lawrence.
My name is Lawrence Nyakundi. I'm from Kenya. I'm a returning student. We were able to do the last class of marriage and family counseling. So I've already registered. Good to meet all of us in class.
Thank you, Lawrence. Okay, let's go. Chinyere, go ahead.
Good evening, everyone. Can I be heard?
We're hearing you.
Oh, good evening, sir. Good evening, everyone in the class.
Good evening.
Good evening.
Okay, my name is Chinyere Onikuchus. I'm from Nigeria. This is my first time. I learned about it. I saw it on Facebook.
Oh,
and I
okay.
immediately got connected. Thank you, sir.
Okay, you're very welcome. We're very welcome. So this is your first encounter with us. We are real. We're not scamming anybody. So, welcome, welcome. You're going to learn a lot more about TIMFA. This is just one of the many courses that we are offering. And if you're joining TIMFA now, you're joining at a very good time. Why am I saying that? Because our certifications now is going to be issued by TIMFA Christian University. So whatever you're doing moving forward now is a TIMFA Christian University certification, diploma, degree, and so forth and so on. So it's a good time to be part of TIMFA. Okay, let's keep going. Shiwaka, I hope I'm pronouncing your name right.
That's correct. That's correct. My name is Truman Chiwaka. I'm from Zimbabwe. I'm a new student. I learned about this through Facebook, and I'm happy to be here. I haven't registered yet, but I'm going to register. How are you, everybody?
Thank you.
You're
Thank
very
you,
much
Truman.
welcome.
Welcome, welcome. You are very welcome once again. Zimbabwe is not new to us. As a matter of fact, we are considering doing our graduation for this year in Zimbabwe. And that's because we have a lot of students from Zimbabwe. And last year we made them come to South Africa for graduation. So, and that broke my heart. We had more students from Zimbabwe, Zambia, and Namibia, and Botswana than South Africa. So I'm wondering, why are we going to Johannesburg? We need to go to where the students are. And that's probably what we'll do this year, if the numbers are right. But Johannesburg is home, second home from here. We have our headquarters in Nigeria. That's where we have the main building. But we're operating from the US. The university is registered in the US. But we have students from all over Africa and Asia, 46 countries all over the world. So we have been around, we're still growing. So let's keep going. Ms. Vivian, would you introduce yourself?
Yeah, good evening, everyone. I'm Vivian Nandinemeno. I'm from Nigeria, but I live in Kigali. A friend of mine sent me the link. She was a student of yours, I think 2 years ago. Yeah, so she sent me the link about it. So that's why I'm here today, and I'm sure I'm happy to be here anyway. That's it. I'm sure I'm going to learn a lot. Thank you.
Thank you. Thank you, Vivian. A lot of new encounters. A lot of us are new. I'm going to take two more, and then we'll go into my presentation. Two more people that want to introduce themselves. If you do, raise your hand. I'll bring you up, and then we go to my presentation. Anybody? Okay, we'll stop here. Let me say this, that as a speaker, one of the things you do is you size up your audience. Who am I talking to? And that would, based on who you are talking to, would determine the language you speak and the content of your speech. So why am I saying that? Obvious thing, it is that we have registered students who today is their first day of orientation. We have also those who are not students who are checking us out. So I'm going to be speaking to those two audiences, populations, with that at the back of my mind. So if you've had some of the things that I'm going to say, just know that it's probably not for you. It's for those who are new to us. So with that, let me go to my PowerPoint, and that would help us to understand a little better. I will take questions at the end of the slideshow or the PowerPoint. Slideshow. Start from the beginning. Okay, this is me. I've introduced myself a little bit. My name is Victor. For real, it's Victor. I am me, myself, and I. No baggage behind me. No generational curse. I am me. That's why my name is doubled. And those are my qualifications. Except for the law degree, the rest of them are all connected to marriage, family, psychology, counseling. So those are licenses that I have. Let me keep going. I took out my open. Okay. So I did say that earlier on. Before now, this certification was offered by TINFA Global Counseling Center, TINFA. But today it's offered by TINFA Christians University, TCU for short. At TCU, we are licensed in California. You can Google that name and find more about TCU. We offer degrees from bachelor's, actually from diploma, certification, all the way to doctorate. This is our first year in existence. Our first student just started, but we are going to get there. So your certificate or certification would carry TINFA Christian University. So it carries a little bit more weight, a lot more weight. What that means is you are blessed. I wouldn't say you're lucky, because moving forward, whatever you're going to pay or you paid is not what you would pay. That would change. So, but be that as you may, you are here, you are blessed. So what are we talking about? Certified mental health and addiction counseling. That's what this is about. It's called CMHAC for short. And today we are doing the orientation. We're going to talk about what it's about, who is supposed to take it, what do you need to get certified, what about books? I'm going to cover all those things. And at the end of it, I will take questions. So why are we doing CMHAC? CMHAC exists to inform. That's the first thing we do, to share knowledge, the wealth of knowledge that we've gathered as counselors, as prescribers, medication prescribers in the US, and all that. And we train. In the next 4 or 5 months, we're going to be training, and we equip. We're not just giving you tools. We are pointing you to where to get tools. I paid a lot of money to go back to grad school for my MA in counseling. I think the biggest thing they did for me that I couldn't do for myself was they showed me where to get resources. And they also taught me which resources are relevant to what I need. That's all they did for me. As a lawyer, I could have read all those things by myself, I can tell you. But I didn't know what to read. I had no idea where to get what to read. So the 3 years that I spent in grad school, the biggest thing they gave me was to show me the resources that I need to have the confidence to stand out and say, I'm a counselor. So we're going to equip you, and we are going to certify that we have equipped you, that you've gone through the process. Some people come here, rather they want to register, they ask us for certification, for certificates. We are not in the business of certificates. We are in the business of certification. So at the end of this journey, if we cannot certify that you have done the work and you can defend the work, we are not going to issue any certificate. The certificate is only evidence of the fact that you know what it says you know. So we will be lying if we issue one without making sure that you know it. So we don't do that. And I can tell you a lot of people have offered us a lot of money just to give them certificate. We don't have time, just give it up to us, and then I need it for XYZ. We don't do that. Why are we in this? I told us that our primary thing is marriage and family. That's our core value. Why? It says that addiction is a family disease. One person may use, but the whole family suffers. One person may use, but the whole family suffers. What does this say? It means that addiction and mental health affects the family in in a way that nothing else affects it. The only thing that comes close to it is grave, losing someone that they love. Addiction affects and changes the dynamics of the family. So that's why we are in this, because it affects a population that we hear about, that we are called to serve. So we want to equip ourselves to be able to remove this obstacle if that's what the problem is. And as a therapist, this comes very handy. Knowing this has helped me a lot, both as a marriage and family counselor, as a grief counselor, as a mental health counselor. It has helped me in so many ways, because now I understand why people do what they do. A lot of people who are grieving turn to drug or alcohol. A lot of people who are dealing with mental health turn to drug or alcohol. So this helps me, or this knowledge, and that's why we are here. So what other reason are we here? Because a mind is a terrible thing to waste. If you have experience, and I'm not talking about personally, but if you've seen somebody who is held down by drug or mental illness, I see them, at least 30 or 40 of those people every week. So I know the devastation of drug and alcohol. I know how much it reduces a person or a human being to nothing. So that's why we are here, to help as many as we can, as many as we can. So who should be certified? Who should take this course? First of all, you take this course for yourself, patients of mental illness. I'm sure some of us are saying, I'm not a patient. I don't have mental illness. No, someone says that for all of us, there's a degree of mental dysfunction. All of us have one. Maybe not exaggerated, maybe contained, maybe controlled, maybe managed, maybe you're coping with it. We do have some. So having knowledge of what's going on with you helps. And obviously, if yours has been diagnosed already, this even helps you even more. So whether you're dealing with addiction, alcoholism, depression, anxiety, whatever you are dealing with, we are going to somehow touch on it, somehow, at least to the level of explaining what it is. So you will understand. Secondly, practitioners. Practitioners take this course. For a lot of people, alcohol and drug counseling, alcohol and drug disease, that's not a part of the curriculum of many medical schools. They have so many things to worry about, I guess. So this is not one of the things that doctors learn. This is not one of the things that pharmacists learn. It's obviously not one of the things that nurses are worried about in nursing school. So this is an area, this is an opportunity for a lot of practitioners to add to the skills. The irony of it is that you encounter these people every day. If you're a medical doctor, you see people with addiction, you see people with a mental illness. If you're a general practitioner, you're not dealing with mental health, you'll see them. And the combination of their mental health and addiction impacts whatever they came to see you for. So having this knowledge will help you. Obviously, if you're thinking about floating your own clinic, your own business, this comes in handy. We've had a lot of doctors, we've had a lot of nurses. We also have had a few pharmacists. One of them said, I'm a community practitioner. I see a lot of people assume that I'm a medical doctor because I give them medicine. So they tell me all kinds of things, and they expect me to be to respond to all their needs, whether it's addiction, grief. So I need to gain as much knowledge as I can. So if you are a practitioner, this is helpful for you. Family members, I just told us that addiction is one disease that one person consumes it, the whole family suffers. So if you are a family member who is caring for an addict, and I use that word very casual, who is caring for an addict, or you're caring for someone who has depression or anxiety, those things tend to reoccur. They stay with you. They go away for a while, they come back. So if you're a family member, you're going to learn, at least be able to identify the warning signs. I'll be able to know when your person needs extra help. And we're also going to talk about suicide prevention and care a little bit. Suicide prevention, it's really not prevention, it's just managing it, because we can't prevent whoever has decided they're going to kill themselves. We can delay it a little bit. Hopefully delay it, they change their mind. It's good for first responders. So if you are the first person that encounters people who are going through crisis, whether you're a pastor, whether you're a community leader, you're a nurse, if you are a first responder in any capacity, just having this knowledge would help you to at least eliminate certain things. Because if somebody's going through drug overdose and you don't know what's going on, then we might be misdiagnosed. You may just not be able to help that person. Leaders, both community leaders and church leaders, especially pastors. You're a pastor and you are, that means you're a community leader. People come to you for hoping that you will help them, whether you're just praying for them or giving them something to go and eat, and knowing what they are going through will help you. And the last one is investors. You may not be interested in all these things that I've talked about. You may just want to make money. This is an opportunity to invest and increase profit if you have a clinic. If you want to invest in rehab, we will talk about all these things. Let's keep going. So hopefully you find yourself in one of these things. Among the practitioners that I did not mention because I've talked about it, if you're a coach, a counselor, a mentor, a helping hand, a healing hand, if you deal with people who are sick, either of the mind, of the body, of anywhere, emotion, this will help you a lot, because those people often turn to drug or alcohol. So if you can help them manage their drug habit or alcohol habit, you would have helped them a lot. So what are we going to cover? CMHAC curriculum covers Module A. We are going to talk about the principles of addiction. We're not talking about the broader spectrum of addiction like hoarding, gambling, sex addiction. We're not dealing with all those. We are talking specifically about drug and alcohol addiction. So we're going to talk about the physiology of it so that you understand what it means that to say that somebody has an addiction problem. In the US, now that name has changed. It's no longer addiction. What they use for it clinically is substance use disorder. Substance use disorder. That's the medical name now. Then they may have cocaine use disorder. Then they may have marijuana, cannabis use disorder, and on and on and on. So they've removed the use of addiction, that I have it in this class, because otherwise we'll be lost. Module B, skills. You're going to learn skills for counseling addicts and alcoholics. This is one of the hardest population to deal with. Why? Because what's dealing with them is overwhelming them. So you're going to need that special skill to know what to say to them that would move the needle. If you don't have the skills, I doubt that there is anything that you can say to them that they haven't already told themselves in the course of their addiction, or that family members have not said in the course of their addiction, or their experiences have not told them. There are very few things you're going to say them that they haven't had before. But we will learn their mind. We'll learn how to talk to them in the language that they understand so that you can make progress. For context. Now, some of these things have changed a little bit. When I got into this business, addiction treatment used to take 90 days of inpatient and outpatient treatment. 90 days. That's 90 days that they are going to hear and learn. So that has changed a little bit because of insurance issues. But in those 90 days, that's a statistic that says that people who go through 90 days treatment successfully, after 2 years, 40% of them relapse. After 3 years, 60% of those people are back using drug. Why am I saying this? This is a disease that is prone to relapse. People are going to relapse, no question about it. So, in fact, some treatment models include relapse as part of the stages of progress. So people are going to get well, people are going to relapse. Whether they are lapsing or relapsing, that's what we are trying to help them to prevent, so that the period between the relapse and the lapse and the functioning is extended. I've had patients who have been sober for 16 years. I had one, that's the longest one, 16 years. This guy never had alcohol, never drank once. His mother died and he started drinking. He told me, I took one beer on Friday. By Monday, I was drinking 12 beers a day. By Monday. So that's how fast the relapse is. For 16 years, this man never had alcohol. He took one on Friday. By Monday, he was drinking more than he drank before he stopped 16 years ago. That's how powerful this disease is. So if we don't understand it, we won't be able to have them. So we're gonna learn a lot of motivational interviewing skills and how to help them. On Module C, we're gonna talk about addiction and family, the dance between the addict and their family. Some people start using and drinking because of the dynamics of their family, because of what's going on at home. I'll give you one example. A man and a woman may start drinking because their marriage is falling apart. That's one. A man and a woman may start drinking because genetically they are prone to that. That's another way family starts it. Now, when they start drinking, you need the family to help them to stabilize, whether they're in treatment or not. If they are going to come to treatment and go out, you need the family. So the family may start it. You need the family to help them go through treatment. You absolutely need the family when they are ready to return back to the system. Things have to change. If this guy is drinking because somebody's triggering him at home, we're going to have to address that trigger before he goes home. So if he's drinking because everybody in the family drinks, so we are going to either move him to another family, another place, or have everybody in the family cease fire for a few times until he's able to stabilize. So it's a dance that the family dances with the addict. Obviously, I've told us that what the addict does, the money he uses, the accident that he has, all the things that the shame he brings, it impacts the family. So we are going to learn the addict or the mental health person and the family. How does it affect them? How can we leverage the family to help our patient to make progress? And in Module D, we are going to talk about mental health disorder. So if you want to miss any of these things, this is the mental health part of this course. Basically, we are going to talk about the physiology of various disorders. My wife is a mental health prescriber. She's a psychiatric nurse practitioner in the US. Those are given the license to prescribe medicines. So she teaches this class. So if you are wanting to learn about yourself, about depression, anxiety, this will be here in this module. And this module also is where we talk about suicide and suicide care, suicide prevention, suicide care here. Somewhere along that line, we will talk about group therapy. And then we go to module E, the family and the business of addiction. This is where we talk about how do you set up, what do you need to set up, and all that. This will be tied to module F, which is the capstone and the practicum. The capstone will start from now. And the next class, I will introduce the capstone. What is the capstone? The best way to understand the capstone is that it's your business plan for CMHAC. This is where you write about what you're going to do with this course. Remember, I said that what we do is to teach you and send you forth. We don't want to send you empty-handed. We're going to write a business plan through this course so that at the end of it, we review it, we guide you, we provide direction so that if you want to finish this course and go straight into practice, you have the basics that you need to start. So that's it. Practicum, we used to actually do a lot of practical things, but with COVID, we're really not able to do that. But we will also provide guidance as to where you can go to get some experience in that. How do you get certified? One, you have to attend the classes, either live or watch the videos. You have to do one of those things. Number two, you have to complete the module quizzes. Number three, you participate in class discussion. If we haven't added you, we're going to be doing that between today and tomorrow. We'll be adding you to Google Classroom. That's where we're going to be having our discussions. Number four, you're going to have to earn at least 80% in your final exam. 80%. You're going to have to earn that. This is the American system. It's not the British system where 40%, 50% C might pass you. This is the American system. It's an open book, but that doesn't mean you're going to pass. So there's an American system, there's nothing hidden. Everything, you take the book, go home, go take the course. If you do the work, you're going to pass. If you guess it, you're going to fail. So the idea is for you to know the course material. That's what they do here. They don't care about hiding, giving you trick questions. No, they give it to you straight, but you have to go find it where it is. Number five, you have to complete the capstone. Every class, one or two people come back and say, I don't need the capstone. I'm not practicing with this. I just want knowledge. If that's you, just know that if you don't do the capstone, I'm not going to give you certification. The capstone is what certifies you. It's part of the curriculum. If you're just gaining knowledge, then you don't have to do the capstone. But don't come back at the end and say, well, I did the course, I paid for it, I need a certificate. No, the part of the requirement is that you complete the capstone. And I'm emphasizing this because I've had a couple of lawyers who took this course who told me when it was capstone time, because they didn't have time, they told me, well, I just wanted this course to have the knowledge. I'm really not looking to do any practice with it. So I won't do the capstone. And I said, that's fine. If that's, just know that we will not give you a certificate. So when they now saw a lot of people, those who are graduating, preparing for graduation with all the fanfare, they felt left out. They came back to me and said, why did I pay all this money and sit down for 6 months? I can't graduate. Well, you didn't finish the course. That's why. So don't come at the end and ask me that question. This is the time to make up your mind. Choose. You don't have to do it, but if you need certificates, if you need to graduate, you have to complete and then attend the graduation. There are two ways of attending it. One, we may do online, which is virtual, attend that, or on-site, you attend that. One of those, attendance would be part of it. So what is the time, tuition, and duration? The duration is 14 weeks. from January to May. How much classes? 2 times a month. Now, there may be some months that just because of availability, we may do 3, or some months that have 5 weeks. But for the most part, it's 2 classes a month. For instance, this month, we're only going to do 1. So somehow we're going to cover it along the line. What is the duration of each class? About 2 to 3 hours. Please prepare for 2 to 3 hours. If you are in Southern Africa, I know that this class takes you to 12 a.m., 1 a.m. I know that, but it's only twice a month. So prepare for it and let's roll. We already know ahead of time. Because of time differences, when you guys are 7 o'clock and 8 o'clock, it's actually my 1 o'clock in the afternoon. So for some people, we had somebody from Australia take this course. It was morning the next day. So we are at different places. So prepare for it. Now, tuition, highly affordable and incentivized. What am I saying by that? The tuition has been highly subscribed, highly reduced. Why am I saying it? I teach this class here. The students that take this course, granted, they do a lot more. They go to class Monday through Friday, but they pay $15,000 and more to take this class. It's the same curriculum. The only thing that is not in what they cover that you won't cover is the ethics of the course. I'm not adding that again because the ethics is mainly about Texas. The ethics of Texas may not be the ethics of South Africa. So that's why we don't have that there. So the tuition, some of us are paying one time. Some of us are paying through the 5 months. So if you decide to pay through the 5 months, we basically take the tuition and divide it into 4. You pay 2 at the beginning, about 20% down at the beginning, and then you start, then you pay as you go. The idea of this course is to train first responders for Africa. And hopefully, as we are planning down the line to start a school of psychotherapy somewhere in Africa, this will be the bedrock for that, the foundation for that. That's the idea. So we are really not stupid in the tuition. We are doing it because we're going somewhere, as we always do. So we are going to provide class materials, so don't worry about it. We are also going to recommend materials for you to read if you want to advance yourself and add more knowledge. So TINFA will furnish basic addiction and physiology of addiction. That's the principles of addiction. We will furnish 12 functions of addiction counselor. These are the 12 things that you must know if you're going to say, I am an addiction counselor. Now, I'm not likely to do all the 12 in your practice, but you need to know that that's your role. That's your function. We're going to talk about the principles of counseling, a lot of motivational interviewing, a lot of counseling theory, a lot of addiction and family. These are all the materials that we'll give you, plus others. This is the material. What am I recommending? There are 4 books that I'm recommending. The first one, if you are a Christian and you are thinking about approaching addiction counseling from a Christian perspective, the first 2 you need to read. The first one is the 12 steps to a spiritual, 12 steps, a spiritual journey. You need that. If you are somewhere in Nigeria, we can arrange for you to have that if you're willing to pay for it. I don't know about South Africa, but this is in Amazon. You can find them in Amazon. The second one is Addiction and Grace. This is really one of the authors. He was a medical doctor who drove this point home, who saw addiction from a Christian biblical perspective. He kind of explains it, and I think it's interesting. Motivational interviewing. You don't have to buy all this, but if you can, it will help you. And then the one that is really expensive, but unless you're thinking about teaching this course, you don't need, but that's addiction counseling, learning the language of addiction counseling by Jerry Miller. So these are recommended. What's our training module? It's a conference style. It's a conference style. I'll speak, I'll take questions at the end. The second point to be made is experiential. I really would like for you to get to know some of these things, get the information as much as possible. Don't be like me. Don't be like me. When I was practicing law, I was a criminal defense attorney, but I hadn't seen any drug before. I didn't know what cocaine was, but I was defending someone who was caught with cocaine. So you go figure. So now I was required to go to the courthouse because they do it here. You have to go as a lawyer to go and view the evidence. So when I got to the court clerk, she took me to the room where they store this evidence, and she took me to a table that was full of evidences of people. And she said, "That's your basket there. That's your basket. You can look at the name, pick out your own." I didn't know what cocaine was. So I was looking at her and she was looking at me. She figured I had no idea what I was looking for. She said, "Counsel, you haven't seen cocaine before?" I said, no, I have not, but I'm here to defend my client. So I guess I'm going to touch it today. So don't be like that. We want you to experience it as much as you can, even though you're not an addict or you may not have mental illness, but just knowing it would help you. And then we want it to touch you. We want this experience to touch you. Unless it touches you, it's not going to drive you. I'm here because these things touched me. Whether it's grief, whatever it is that I'm doing it with passion because I've been transformed by the experience of seeing people go through it, sitting with them, just empathizing with them. That transforms me to a different person. That's why we are here. So rules of class, when you're in class like we did today, I want you to meet yourself. Announce yourself as you log in. I'm hoping that just as we do with all Team for courses, that you will label your name. You would, at least so we know who is logging in. Ask questions. For me, Reverend May is more interactive than I am. I will teach, I'm more professorial. I will teach at the end of it to take questions. Participate in class, I expect that. Comply with my deadlines. If you can't, just reach out to me and then I'll be more than happy to accommodate you. But let's not come after the test and then you come and give me an excuse. Tell me why you didn't take the test. I prefer that you tell me that you're not going to take the test because of XYZ. Not that you didn't take the test because of XYZ. Unless it's an emergency, I can understand. But if it's something that you knew was coming and you did not take the test and afterwards you're telling me this is what happened. I went for a burial. I went for marriage. No, you knew you were going for burial. I should have known before then. So that's it. Any question or comment? And then we'll go. Question or comment? And if you don't have question or comment, at least you should be clapping for me. I've zapped through a whole semester of coursework in 45 minutes. That's something. That is something. So I should at least get a clap from you as opposed to thank you, my dear. If you don't have any question, if you are confused, that's understandable. For some of us, this is a new area. I understand that. That's why you're here to learn. Thank you, Chiere. Thank you. Thank you. All those people who are not clapping for me. You don't have any question. You don't have any clap. You don't have any chat. Okay, you can't just do that. You gotta do something. Okay, thank you. Anybody? Question, comment? Let me expand, spotlight myself. Okay. Question or comment? You can type it in. You can ask, and if this is making you seriously consider joining us, we are going to be open to. We're going to be taking admission till the end of this month, and this is because we're not having any class until 2nd of February. And for those who have registered, you're going to get the syllabus and the materials for this module, module A. Those things will be sent out tomorrow. So somebody is saying something at the back. We'll be sending those things out. So we are in class. We meet on Zoom here on the schedule. Please follow the syllabus. I follow that. If you follow the syllabus, you're going to be okay. No question? Are we ready, though? Are we ready to go? Those that are not ready, kindly, okay. A quick regarding graduation Saturday. Let me see the questions. Thank you, Doc. But a quick one regarding graduation. Saturday graduation are not favorable to me due to religious conviction. How will I be assisted? Obviously, we will accommodate that. We will understand if you have a religious reason why you can't join us. That's what I'm talking about. Now you're telling us ahead of time. Yeah, we will accommodate that. We can't make you go against God or your God. No. So what it means is you just have to watch afterward. We record all our classes. I didn't say this, I think I missed this point, but all classes, including this one, are streamed to the Facebook group. So you can watch it at your convenience. It's a private group. Please don't share the login. Obviously, if you do, we're not going to permit, we're not going to approve it. Thank you. Any other question? So it's only this orientation that is free. Yes, this orientation class is the only thing that is free. The next class, I will just have only the registered ones. I have a lot of a lot of videos and podcasts that I've done on mental health. That's on our videos. So if you want to watch that, but as far as the class content, it's only for this orientation.
I have a question, please.
Sure.
Yeah, please, Doc, how do you register and how do you make the payments? How do you go about it? Because I'm new, I don't know.
Okay, I am so sorry. I did not say that. If you want, somebody's also asking how much is the tuition. If you are in the US, if you're paying in dollar or in rand or naira, those are the three currencies that we accept. One, if you're paying in rand, it's 14,500 rand. If you're paying in dollar, it's $995. 995, yeah. If you're paying in naira, I think it's 850 now. Now, for those who are paying in naira, that's a shifting ground. That's why I'm guessing, because the naira today is down, tomorrow is up. So right now we're not even tying it to the dollar. If we tie the naira equivalent to the dollar, you're going to be paying at least 1.2 billion. So that's why I can't give you specific. Depends on what you're registering. But as of today, we are doing 850 as of today. If you pay in bulk, if you pay one-time fee, you get 20% discount. If you do one-time fee, you get 20% discount. If you do flex pay, meaning you're dividing your payment across 5 months, obviously you pay the full amount. But we will give you a breakdown of what you pay monthly. But you're going to pay 20% down, and then we divide the rest. How do you pay? If you
Okay.
type in, let me see, the staffs are supposed to be here and sharing login. Okay, let me give you, let me type in my number. Please reach out to me on WhatsApp.
Okay.
Okay, my phone number is there, 1281-701 7850. Reach out to me directly. I could also just type in, copy and paste the WhatsApp. Let me see if I can get it. Got the WhatsApp. Any other question while I'm doing this? Any question or comment? Okay, I've just posted the link to our certificate. So click there right now. It will take you. I've posted that on the chat box. If you click to that, it will take you straight. If you are in Zimbabwe, if you are in Zambia, Botswana, and you're paying in dollar, that's $9.50. If you're paying in rand, you're able to get to South Africa, Juba. We have an account there that you can pay in rand. And by the way, you pay according to where you are. If you're Nigerian and you live in the UK, or you live in Canada, and you think, okay, it's easier to pay $8.50 than to pay $9.50. We accept the currency of where you are residing. That's the reason why we are leaving the differential between the dollar and the naira, the way it is for now. Please pay where you are. If you're in the UK, pay dollar. If you're in US, pay US dollar. If you're in Nigeria, you live in Nigeria, then we accept your naira for now. Anybody else? Any more question? So Chinyere, have you gotten, I think you were the one asking me, have you gotten my phone number? Okay. Those who are new.
Oh, I've not sent the phone number.
Okay.
I didn't say it. It's not posted yet.
Were you the one that asked me for how to pay?
Yes, yes, Doc.
Okay. Now you have my number. You have the. It's here, just above the chart. It's on the chart.
Okay. Okay. I'll
Both
look for it.
Both the WhatsApp link and my phone number is here. For you and for any other person who wants to reach us, you can connect with us from there. Okay, I will end here. God bless you all. God bless you. Bye-bye. And those
Thank you
of
so
us
much,
who are
Doc.
registered students, I'll see you on February the 3rd. That's the next time we have class. God bless you and bye-bye.
Bless you too.
Thank you. Bye.
Bye.